Inspections, and Dr. Tim, help me out with what IFIC stands for.
Institutional Animal Care and Use Committee.
And that is what allows us to keep animals here. So they do regular inspections. We have people come over probably about every 6 months. So you'll see us frantically cleaning and asking for help. And so this last one, they noticed that we didn't have all our volunteers taking this training. So this is why you are here today. So usually it takes somebody to notice we're missing something for us to have to do a training. So there's a lot of paperwork involved with it. So we do have a sign-up sheet going around. So please sign that. That will go to the main campus at OSU and let them know that we have this many volunteers trained up on this. We are also recording this, so if you speak to any of your fellow volunteers and they aren't here today, let them know to catch up with Becca, and they will need to watch this recording and get trained up and get signed on for our main campus constituents. This is Matthew Philpott. He is a biological safety officer. So he is here from, it's very official. So he's here from the main campus to go over non-OSU employee animal safety training. And then we have Dr. Tim Miller-Morgan. He's going to go over the zoonotic disease part of training. So you guys will learn a lot. Okay, thank you guys for coming today.
Thank you. So I'm really happy to be here, and hope that you get some benefit out of this. Please stop me if you're confused, or if I say something that needs some clarification or whatever. I have a question or have something even to contribute. Now, some of what I show you may not be directly applicable to your particular activities here as a volunteer, but it's a very generic thing, because we actually have people at the university who handle all manner of animals. It's really an amazing spectrum of animals. I tried to put a few pictures in here that might be a little bit relevant to the Marine Science Center and some of the activities that are associated here with the center, but again, not everything will necessarily apply to the activities that you actually do. I have brought some of my business cards here, and I'll leave those down here at the front of the auditorium if you would like my contact information. If you ever have questions about any aspect of safety, or particularly biological safety, that's my area of expertise, which involves zoonotic pathogens as well as other types of biohazards, and we would really put animal handling as a potential hazard as well, because there are a number of hazards associated with working with animals. So I'm going to really just very briefly talk a little bit about zoonotics. I'm not going to say much about it because that's what Tim's going to talk about. But what I'm going to talk about more than the specific zoonotics is really looking at how you can protect yourself from zoonotic pathogens. That's really going to be the focus of this. I'll talk a little bit about animal allergies. It's not as big a problem with marine animals as it is with some other species of animals, but still there is a potential for allergy development associated with handling marine species of animals. I'll talk a little bit about physical injuries, and that's going to be very dependent on the type of animal that you handle. If it's a fish, it might be something like a spine injury, but even those can become infected if they're not properly treated right away. And talk a little bit about sharps. And I will not really discuss experimental hazards. That's not something that really is germane to the activities that go on here at least at this part of the center that you're involved with. So the real focus is going to be how do you protect yourself from any of these types of potential hazards associated with animals. And that's really going to be the heart of it is what do you do? What are the steps that you should take that are prudent to protect yourself? And you'll see it's really very simple. Some very simple things, but also very effective things that can be make a huge difference in how your health is impacted by your activities. And it's really all about personal hygiene and selection and use of proper protective equipment, and sharps use if you happen to have to work with sharps for some reason, how you handle and dispose of those sharps. and then in some cases safety equipment like restraining devices and other types of equipment that might be important in the work or appropriate for that particular species. And then I'll talk a little bit about response and notification procedures towards the end. So I'm going to, as I said, skip through some of this stuff. So Tim's going to cover the zoonotic diseases from his aspect. There are a number of them. He's going to talk mostly about bacteria, but there are some viral diseases that are found in various marine species. And so it is important to be aware of that. And as far as how you get infected, it's usually by contact. But that could also be contact with water or aquaria or anything really that has come in contact with the animal. There are other routes, you can see that on this slide, that ingestion is an important part of zoonotics, particularly of some of the fish species, but probably not too relevant for the workplace here at the Marine Science Center. And vectors are not really too big of a problem in many marine species. So one thing about zoonotic infections is they don't usually spread person to person. So we're not usually worried about you starting an epidemic of disease. We're more worried about you as an individual becoming infected and the possible consequences to your health as an individual. And there are many studies that show that people who have a lot of contact with animals, most of these studies have been done with researchers and also with veterinarians, but all of these studies have borne out the very stark fact that people who work with animals are at high risk for contracting zoonotic diseases. So that is something that to be aware of. And the first step really is to recognize how you can get exposed and then take the appropriate steps to protect yourself and to monitor your own health and as necessary, seek consultation with health professionals that can also provide input and measure and provide you with information about your own health and your own risk. Because all of us are a little bit different, and if you have underlying health conditions, then that can predispose you to more serious illness with some of these zoonotic pathogens. So usually people get infected through what's called an exposure. An exposure would be, it could occur in a variety of ways. One way is through a splash into your eyes, nose, or mouth, some kind of liquid material that contains infectious material. Other ways that can happen is if you have a cut or scrape on your hand, or you get an injury handling an animal that opens up a wound and the infectious material gets in that way. Other things that can happen are like a sharps accident. If you happen to be handling needles or scalpels or some other sharp instrument and you get a needle stick or a penetration through the skin. So all of those are well-established routes. Aerosol is probably not too important in a marine animal environment. So it's one of the things that we do in the biosafety and community is that we look at pathogens and recognize that all of these infectious agents are quite different from each other. And one of the frameworks that's been used to try to make some sense of this, of the 2,000 or so known and well-characterized human pathogens, is to put them into groups. And what they've done is they base this on what they call the healthy adult human. So if you are a healthy adult human, these groups then represent the risk to you of serious consequential disease. Now that said, this is what it looks like. Let me show you how that's set up. There's actually 4 groups. They're called risk group 1 through 4. And most of our zoonotic pathogens fall in risk group 2, although there are some in 3 and depending upon the type of animal species, they're also number 4 as well. In fact, all of the organisms in risk group 4 are zoonotic pathogens. All of them are viruses. So you've probably heard a lot lately about Ebola. That's a risk group 4 pathogen. Now, most of the things that you're going to encounter and the things that Tim will talk about are probably found in risk group 3. And these are transmitted primarily through contact with the various types of animals. And they generally cause moderate disease in a healthy adult human. But again, that's all based on underlying health as well. And that makes the assumption that everybody has the same level of health. That's not necessarily the case. So things like age or genetics or medications or underlying disease, all of those things can impact the status and also can impact the risk. So it's important to, if you have concerns, to talk to your medical provider and get some counseling to see what your risks might be. What I'm going to just briefly touch on here is how you can minimize your risk no matter what kind of pathogen you might come in contact with. And it's really a combination of several things. Appropriate personal protective equipment as necessary. Sometimes safety equipment is used. Really the key thing here is good hygiene and environmental infection control. So I'll talk a little bit about some of those things. So personal protective equipment can be a variety of different things, and it really depends on the task at hand. What you're doing really dictates what is appropriate. Sometimes really nothing is needed in the way of personal protective equipment. But then sometimes, depending upon what you're doing, you might want to put on a pair of gloves or even a pair of sleeves if there's a potential for more splashing and that sort of liquid material getting up a little higher than just your wrist. And then sometimes face protection is necessary, particularly if there's a lot of splashing potential there as well. And outerwear, something covering or in place of your street clothing so that you don't carry home infectious material or allergens or other possible hazards to your home environment or to a workplace away from here. Very rarely would we ever need respiratory protection, so I'm not really going to discuss that at all. So gloves and or sleeves, depending upon the amount of material you might be working with. Whenever you're touching blood, body fluids, secretions, excretions, membranes, or non-intact skin of an animal, if you're performing or assisting with necropsies or any kind of surgical procedure, or if you're handling dirty towels or other laundry that has become contaminated or been used with an animal. All of those situations would be times when you should probably have gloves on. Also, if you're cleaning, so if you're asked to clean an aquarium or a piece of equipment that has been used around animals, it's a good idea to put on a pair of gloves when you do those tasks. And if you're handling an animal that you think might be sick, so I know that Dr. Miller Morgan has sometimes animals that become ill here, probably some of the display animals from time to time, and he attempts to treat and bring them back to health. If you have to handle an animal that appears to be sick, you should probably have gloves on when you do that. Now, a couple things about gloves. When you use them, they're intended for single use. So you want to remove them, and you want to remove them inside out without touching the outer surface. So ideally what you would do, the first glove's pretty easy. You can just strip it off. And you want to do this carefully so you don't generate aerosols of liquid that might be on the outside of the glove. Strip it off slowly and carefully, and then hold it in the other gloved hand, and then put 1 or 2 fingers under the wrist, and again carefully strip off that second glove. And that way, whatever's on the outside of the glove ends up on the center, and you have not touched that contaminated outer surface with your bare hands. And then you're going to want to wash your hands immediately. You should never try to wash or reuse these gloves. They are intended for single use, and they should be appropriately disposed of then once you're done with them. Okay? Face protection is rarely needed, but it should be used whenever there's a potential for large amounts of liquid splashing material. So when you're handling aquaria water, that might be a good time to put on at least eye protection. And you can see there's different configurations for this depending upon what you're doing and what the risk is. So sometimes just eye protection is all that's needed. Sometimes you want to cover nose and mouth as well, because all these are vulnerable mucous membranes. And so there's different ways to do that. Face shield is probably the easiest way. Fast, have a face shield handy, just put one on. But there's other ways to do this as well, using surgical masks and eye protection and so forth. Whoops, I don't know what I did there. Okay, so my recommendations for face protection are, if you're assisting with surgical procedures or necropsies, if you have to clean things with a hose where there's splashback potential, anywhere else there's likely splashing activity. So any of those circumstances, just kind of use your judgment on that. And notice in this picture, this person is not wearing eye protection, and there is a potential here for splashes to get into the eye. So this person has appropriately covered their nose and mouth, but still has vulnerable eyes. So just pays to pay attention to all those mucous membranes at the same time. Protective outerwear can take a lot of different forms, and again, this is going to really depend on what your task is. So there might be circumstances where you would want some kind of coveralls or fluid-resistant outerwear, high boots or something like that if you have to wade in some water. Sometimes a lab coat or a smock or just an apron would be fine. It really is going to depend on what those tasks are. We recommend that you have something over your street clothes or in place of your street clothes if you have to really get up close with an animal. Now, just putting your hand in a tide pool or something like that, probably not. But if you're actually assisting with a procedure with an animal, or you have to capture an animal, then that's probably a good idea to have an apron or something on to help cover your or protect your street clothing. And when that becomes soiled, then you want to change it. And also, if you have handled an animal that may be diseased, you're going to want to change that so you don't potentially spread illness to the other animals as well. So we're concerned about your health and safety, but we're also concerned about transmission of disease amongst susceptible animals as well. This is just a picture from over here on the beach. Some of our veterinary students came over to carve up a dead whale on the beach a couple of years ago. Footwear, pay attention, depends again on what the circumstances are. If you have to wade around in a large aquarium or something, you're going to want some fluid-resistant footwear on, certainly. Probably the most important thing that I can tell you today that is very universal is to practice good hand hygiene. So you want to wash your hands frequently with soap and water is best. After you've had contact with animals or animal fluids or secretions, and after you remove gloves. So if you have to wear gloves to do a procedure, after you take those gloves off, there's some potential that your hands may have become contaminated through a pinhole or something in the glove. So go ahead and take an extra minute and wash your hands before you put on a new pair of gloves or go on to do some other task. And certainly before you eat, drink, smoke, handle contact lenses, or anything that would involve touching your eyes, nose, or your mouth. And when you do wash your hands, it seems like a simple thing, we all do it, but a lot of us do it wrong. So make sure that when you do wash your hands, you pay attention to your wrist area. Most of the contamination on your hands is going to be on the fingers, on the inside of the fingers and the palm of the hands. But you want to make sure that you get all the surfaces, even between the fingers, especially around the nails and around the wrist as well, because those are often overlooked. Now, sometimes soap and water is not readily available. Under those circumstances, these hand sanitizers actually do provide protection, at least against certain kinds of microorganisms. And so that is a helpful thing to do as well. And then disinfecting equipment and surfaces, that's a very important part of staying safe. Make sure that you are protected because these chemical disinfectants are sometimes hazardous to handle. And so you want to make sure that you read the label. If it says wear gloves when applying this product, make sure that you do that. Always follow the manufacturer's instructions when you're handling those products because some of them do have some pretty toxic chemicals in them. So you should be cleaning and disinfecting surfaces that are then going to be exposed to other animals in between use. And if you have to handle towels, dirty towels, or other kinds of laundry that may have become contaminated, make sure that you, again, wear your gloves when you handle them, segregate them into different bins, and wash them with soap and warm water. If you have a spill of blood or body fluid from an animal, or even possibly a human in this, this circumstance, where you have the public coming in, someone might get a nosebleed or something like that. There's a safe way to do this, and that is, first of all, you want to keep other animals and people out of the spill area. You want to make sure that you are protected before you try to remediate any kind of spill. So make sure you have your protective equipment on, your gloves, protective gear if you need it, eye protection if you need that. Use then a combination of disinfectant and absorbent materials to remediate the spill itself, and then mechanically scoop that up and dispose of it in a bag for disposal and clean the area once again. Say just a couple things about allergies. It's not a huge problem with marine species like it is with, say, laboratory animals or even certain livestock, but it does happen, and so you just need to be aware that allergies, contact allergies with animals are a very common thing. And studies have shown that, for example, for laboratory animal workers, and that would be people primarily working with mice, rats, rabbits, guinea pigs, small animals like that, the furred species primarily, half or more of those people without the appropriate protective gear will develop animal allergies. And this was a huge problem, unrecognized problem until a few years back. And some major studies were done that showed that this was a big problem. And since then, it's become less of a problem because people have implemented ways to protect themselves from these allergens, and that's been very helpful. So the people who develop allergies to animals, the vast majority will get nasal or eye symptoms. About half will get skin allergies, which usually manifest as rashes and hives on the skin. And up to a third of these individuals, if interventions are not conducted, will go on to develop serious asthma problems. With marine species, the skin allergies are the most common type, so that's likely to be the first symptoms that you might experience. So not all animals are equivalent, so some animals lend themselves apparently more favorably to developing for humans to develop allergies to, and those are typically going to be the rats and lagomorphs. So rodents and lagomorphs, rats, mice, rabbits, those are the most common types of animals. Birds come in close second though, and particularly people who are exposed to large numbers of birds, like in a nesting colony of wild birds, or in a poultry facility with domestic birds. They often will develop very serious respiratory allergy called hypersensitivity pneumonitis. It's a very serious problem. But other kinds of animals are possible as well. Even a number of marine species, there are reports of that. Typically, again, these are usually skin type of sensitivities that manifest as skin allergies. So in terms of what people are at risk, it's our current understanding that anyone can develop allergies. Some people are more prone to it than others. And some very clear evidence shows that people who have pre-existing animal allergies are more likely to develop allergies to other species. So let's say if you're allergic to cats and you start to work with some other kind of animal, then you are much more likely than the average individual to develop allergies to that second type of animal because you already have animal allergies to one species. So that seems very clear. Also, people with repeated contact, and that's often people who are engaged in animal handling activities, usually have repeated contact. And so what has to happen is you have to have sensitization, and then over a period of time, if you have repeat sensitizations, sometimes as few as twice, two exposures to the same species, you can begin to develop allergies. But for many people, it takes many exposures. So again, back to the repeat thing. So if you are exposed to the same animal over and over again, your chances increase of developing allergies to that type of animal. Also, food allergies to fish or shellfish are relatively common in the general population. And if you have food allergies to fish or shellfish, you are at risk from contact allergies to those same animals. So just because you're not eating that crab, if you handle that crab, you may be at risk for allergies for that animal as well. So just be aware of that. Most allergies will develop within 6 months to 36 months of exposure to a particular species of animal. And that's not to say that they cannot develop after that 36-month timeline, but it's much less common after that. And they usually start as either skin hives, irritation on the skin, or nasal, eye, and throat irritation. And hives are going to be the most common thing for a fish allergy.
Matt,
Yeah.
I have a question here.
Oh, I'm sorry.
I was just curious about visitors in the touch pool, in the touch tank, if they have fish or shellfish allergies. Is that a concern?
You know, that's a good question, and it could be. It could be, and I'm wondering if, maybe there ought to be some kind of sign, posted here in the facility to warn people. Typically, as I understand it, they probably just like reach in and briefly touch an animal, and you do have wash stations here as well. So I would certainly remind people to wash their hands afterwards for a variety of reasons, but this being one of them. So yeah, that is a possibility. I don't know that a single contact like that. Some of those shellfish, and particularly shellfish, but also fish allergies, are of the most severe kind, the anaphylactic type of allergies, and so those people they're very sensitive even to minuscule amounts of the allergens. So it is a possibility. So in terms of minimizing risk, we use an annual questionnaire for our employees, and I think volunteers fill out a little bit different questionnaire, is my understanding of that, the way that program works. But certainly consultation with a medical professional is a good idea on a regular basis if you're working with animals. And if you feel that you're beginning to experience the signs of allergies, definitely you want to go seek medical advice from a professional that can advise you on whether or not you should maybe discontinue those activities, or there may be interventions that can be done. Maybe it's just as simple as putting on gloves more regularly and more routinely, or under more circumstances than you might normally do. Most of the allergens for various types of animals are airborne. So we come in contact with them either through breathing them in, or they land on surfaces and then we touch those surfaces. But there are also allergens that are actually on the animal itself, and those we come in contact with primarily through handling the animal, touching the animal itself. So gloves, protective clothing, those kind of things will definitely help, particularly if you know that you are allergic to a particular species. It's a good idea to make sure you put on a pair of gloves before you handle that type of animal. Physical injuries then are another issue or hazard of working with animals. And again, this really depends on the type of animal species. Obviously, people who go out and trap wolves or mountain lions, they're probably at more risk for physical injuries than someone who handles fish or crabs in a tank. But there are potential injuries that can occur with many different species of animals, and there are some consequences to that because, as you can see, sometimes they become more severe situations. This is actually from a person who handling fish and had a wound on their hand, and they got an infection. And probably Tim will talk about this. It's a bacterial infection, and it's not something that would necessarily happen, but it is a risk that you need to pay attention to. And if you feel that you have an exposure through an injury, and just pay close attention to whether that appears to become infected, and seek medical attention as early as possible, because often these injuries can lead to soft tissue infections. Again, depends a lot on the different species and the circumstance as well. Large animals can cause significant injuries just because of their size, their strength. Birds, if you have to handle particularly wild birds, they will often go right for your eyes. So back in the day when I did field work, we were capturing seabirds, and those I can tell you from experience, the first thing they do when you pick them up is try to peck your eyes out. So you have to be very careful and have eye protection on when you're doing those kinds of studies. So it's very important to have training from the people who are more experienced to show you how to properly handle an animal and how to restrain that animal. And that's important for the animal's sake as well as for your own, because if they're restrained properly, there's only limited ways they can move, and the risk of them injuring you or themselves is greatly reduced. Now, I'm not really familiar with the various restraining devices that might be used in marine species. I've seen them capturing sea lions, but that's a little bit different than handling fish. I don't know if there are actually restraining devices available. Tim would be a much better source on that. But if they are, and it's appropriate to use them, then I always recommend those, because they do reduce the risk both to the individual handling the animal as well as to the animal itself. And then things like eye protection, protective clothing, gloves, all the things we've already talked about also will help protect against physical injuries. Any kind of barrier is going to be a helpful thing. Sharps accidents, if you have to have occasion to participate in activities like necropsies or perhaps even a surgical procedure on an animal that involves the use of sharps, then you definitely want to pay close attention to what you're doing and monitoring that sharp instrument at all times. So the main things here are when you set it down, make sure you know where it is and that it's in a place where it's not going to injure either you or someone else. You don't want to carry an open sharp across distances, so generally we like to see some type of disposal container right there available where you're working. And there are some pretty simple rules for that, but sharps injuries can be, depending upon the sharps involved and the circumstances, they can be a portal of entry for a zoonotic pathogen, for example, so you might get infection as a result of that, but they can also lead to significant injuries as well. So again, these are our students cutting up the whale on the beach. So we do have on my website, which I think the web address may be on the card. If not, if you just go to Google and go to look for environmental health and safety at Oregon State University, there's a link there for the biological safety website. And I have a lot of good information on there about sharp safety. And in particular, there's a document that's about a 10-page document that explains very clearly how to handle sharps safely. And I highly recommend that for anyone who's going to work with sharps in any of their activities. So basically, it boils down to the main problems we see with sharps use are when people use a needle, for example. Most of our sharps accidents on the campus involve a situation where someone has used a needle to give an injection or collect a blood sample from an animal, and then they try to recap that needle. So by trying to recap that needle, if you're doing it with two hands, it's very easy to stick yourself in the thumb or the finger or even the palm of your other hand, especially when you're handling an animal, because the animals sometimes move unexpectedly and they can jostle you and you can end up poking yourself with the sharp instrument. So most of our accidents occur when people are trying to recap a needle. And I've even seen people put the cap between their teeth. So I would say probably about 80% of the sharps accidents we have are directly caused by people trying to recap a needle. So one point I want to make is that it's almost never necessary to recap a needle. So if you have the proper disposal container available in your where you're working, and that looks like these things here, these red boxes with the biohazard symbol on them. In the state of Oregon, we're required to dispose of all used sharps into those containers. Even syringes, even if they don't have a needle on them, have to go in these containers for disposal. And they're designed so that it's very difficult for a needle to actually penetrate through that from the inside. And so it's almost never necessary to recap a used sharp. Just simply discard it into one of these containers and have that container right there where you're working.
How is the container disposed of?
So what we do is we collect those. Our department collects those for any OSU facility. And we pay a contractor who takes them to an incinerator, and they're incinerated to ash. Just a couple of follow-up things, and then I'll turn it over to Tim here. Incidents and accidents should always be reported, so you want to make sure that the supervisor, whoever the supervisor is at that time that occurs, knows that there's been some kind of an incident or an accident or possible exposure, something like that. They've changed a little bit how they used to be done through a series of paper forms. Now there's this website that's called the HR Advocate, and the supervisor then goes to this website, and the address is here, it's a one-stop reporting place really for all kinds of things that might, and it involves anybody, even volunteers, anybody who's working in an OSU facility. If there's an incident or an injury, that's how it gets reported. And we do want to make sure that people are appropriately evaluated with the and first aid is if it's an injury, that first aid is done promptly, and then they get medical evaluation. So know where to go for a medical evaluation if needed. Bite wounds have a risk of infection, and so you want to wash with soap and water. If it's bleeding, let it bleed a little bit. Obviously, you don't want somebody to bleed to death. This, I believe, is a shark bite, but obviously you don't have any sharks here, so that's a good thing. But wash the wound. If you do have a bite from, let's say, the octopus bites you, you want to wash that out with soap and water, treat with antiseptic from first aid kit, and then, as necessary, seek medical attention. Also, be aware that animal bites, and they don't really define this in terms of what an animal is. Pretty much any animal bite by Oregon law has to be reported to the local health department. That is a state law. And also most zoonotic diseases are going to be reportable as well. And then if there's an incident that involves some kind of animal welfare problem, then that has to be reported to the IACUC. And again, the supervisor should be the one doing this. They can consult with the IACUC personnel to find out how to appropriately do that. And then obviously security breaches and things like that would have to be reported directly to the police. So contact information for IACUC, and again, this is Institutional Animal Care and Use Committee, and this is a committee that oversees all of the animal use associated with the institution. This is how you can contact. They have a website as well as an email address that it's pretty easy to contact them. Here in Lincoln County, the health department is here in Newport. And then this is my contact information. I'm over on the main campus. And again, I did leave some of my cards here. Feel free to contact me at any time if you have questions or concerns. Okay, so with that, I'm going to turn it over to Tim.
Visitor Center and back in the West Wing. If you have a welfare concern about an animal, of course, Colleen and I would appreciate that you report it to us. But if for some reason you didn't want to do that or didn't feel comfortable, there is information where you can just contact the ICRIP administrator or the attending veterinarian for the university directly. There's actually a mechanism for that as well, and that information is posted all around the visitor center. I believe there's a sign on the door coming into the visitor center, going into the main building, and is there one?
Signs, lots of places.
There's signs lots of places.
Posted
They're all
signs
over the
everywhere.
place.
So there's one at the door of the visitor center. There's one, I believe, at the food prep door. Inside there's one in West Wing, both in our lab and in West Wing and in front of both ed labs that we take care of. I can hand out copies too if you want to.
There it is. Okay, so I'm going to talk about zoonotic diseases, and I'm going to really focus on mainly the bacterial agents that have zoonotic potential, because that's really where our greatest risk seems to be here. We'll cover again some of the same things Matt covered in terms of personal protective equipment, that kind of thing. But focus a little more on our unique situation here. This is Dr. Tong, International Journal of Dermatology, kind of covered this pretty well. Now that we can bring these animals into captivity, we can get bitten, scratched, and venomated in our own homes now or our own facilities. So, with that in mind, again, let's review quickly. A zoonotic disease is an infectious disease that can be transmitted between animals and humans. Okay? And specifically, we're talking about a bacterial zoonotic disease. And so that's a bacterial agent or a bacterial disease that can be transmitted between animals and humans and actually cause disease. What I want to do first is just talk about what are our risks. And in general, using the precautions that we talked about here, I've found over the years, and we've seen within the aquarium world that in general the risk is pretty low if you're using these precautions that we've talked about. And but typically, where do we find these bacterial species? Well, we can find them in our fish, we can find them in the invertebrates in the system, our transport and our holding water when we're moving animals around, and certainly in some of the surfaces of the tanks and some of the life support systems that are associated with that, in the biofilms, the films that coat the surfaces of the tanks, that kind, and the pump plumbing. We certainly can see that. But generally, if we're using some of these precautions, the risk here that we've seen is pretty low. But there are some organisms that can cause disease. And who's really at greatest risk? Well, individuals that are immunocompromised. And this is an issue that people that are very young, people that are elderly with some health issues can certainly be immunocompromised. And then people that have immunosuppressive diseases, like active AIDS, certain types of cancer, or people that are on immunosuppressive drugs. They're at greater risk. And so you need to think about that when you're working with systems, or you're working with the animals. And it may be that may be a time, say if you're working at the touch pool, if you're dealing with one of these issues, you may want to think about maybe I can work in a different area for a while. Chronic diseases, liver disease, diabetes, hemochromatosis, renal disease, there are others as well, but these are some of the common ones that come up that kind of put you at a little greater risk. And then there's certainly the work-related practices, not having adequate sanitation procedures, not, Matt was mentioned, washing your hands regularly after handling the animals. And proper animal handling, this would be more applicable to those of you that are helping us in the West Wing or helping us move animals as husbandry or feeding volunteers. And proper disposal of dead animals, that's not going to be something that you're typically going to have to deal with. But those are some of the things that can certainly increase the risk. So what is really the reality here? Well, typically the bacteria we're worried about for the most part are some of the gram-negative bacteria. I've given you a list of species. That handout that you have lists a lot of these. The ones that are sort of highlighted are the species that we tend to see here, isolate here commonly, and typically in the aquarium world tend to be more of an issue in my experience. The Aeromonas species doesn't really pop up a lot in the human literature as a zoonotic disease, but there are a lot of reports of Aeromonas infections that people have picked up from cuts or bites or scratches that have caused sort of localized infections in the soft tissue and that kind of thing. Vibrio as well. There are a number of species of Vibrio. Some can be associated with gastrointestinal problems, that kind of thing. Here we're talking about some of the Vibrio species that are associated with local infections that may spread in severe cases throughout the body, but typically they tend to be more localized. And in most of the experiences that we've only had a few incidents here, but in different places that I've worked, most of these infections, if you do get infected, tend to be localized. And we may at the end want to elaborate on that a little bit now, but that's sort of been our experience here. The gram-positives, these are basically just two groups of bacteria. We don't really need to go into what the differences are at this point. But one of the big ones that we see very commonly is a Mycobacterium species. And this is not the mycobacteria that causes tuberculosis. This is, there's a number of species. Right now there's about 8 or 10 species that are associated with, particularly with fish and with some invertebrates, that can cause problems. Typically, infection occurs in a human through an extremity, a scratch or a bite or something like that, and the wounds tend to be local. But they can be difficult to eliminate, and it's something that once I show you these images, if you ever have some symptoms or signs like this, you probably want to chat with us so we can chat with your physician, because it can be treated very easily, but it's a long course of antibiotics, and you want to get on it right away. That being said, again, using regular hand washing, if you have open cuts on your hands, wearing gloves, having bandaged and all that, the risk is generally pretty low. But if you've got, a large wound on your hand in particular, and you're doing tank maintenance for us or something like that, that's probably a time to ask us to switch you to some other duty for a while until that heals up. Because this is common, we do see it. It's probably the most common, what we would call a chronic bacterial infection that we see in fish, particularly in farm-raised fish. Especially warm water, tropical fish. We see this a lot, mainly in farm-raised fish. We don't see it in wild fish very often, but it's a huge problem from a veterinary management standpoint, say in zebrafish colonies. So it's something that if you work in a zebrafish facility, they're always talking about, and for two reasons. One, there's that zoonotic risk, and the other reason is it's a problem for the colony, trying to manage that colony. So what are the common routes of infections? Bites, cuts, puncture wounds, and then abrasions that we see. So, there's a moray here, and so sometimes if you're handling them improperly, we get some bites. That happens. It happens periodically. So we need to be very careful about how we handle these animals. If there's an animal where there is a risk like this, that is a biter, and if you're one of our husbandry volunteers, the odds are pretty low that you'd be asked to help with this, or maybe you wouldn't be necessarily working directly with that animal. You may be helping us in some other capacity. getting at your animal control devices. We have many nets, totes and things that we can move the animal into, and we can handle the animal to reduce our risks, certainly. This is something you have to think about in the touch pool. We've had this happen a few times, mainly with people that are leaning over the touch pool and slip and get their hand on an urchin and get some puncture wounds like that. Certainly that's a potential route of infection. And cleaning these wounds up really well is pretty important. Mycobacteria, this is a classic lesion for mycobacteriosis. I believe this is Mycobacterium marinum. And what you'll tend to see, usually on the extremities, this is on the arm, you'll see this wound, an ulcer, or a raised area, reddened area, that just doesn't seem to heal for a long time. It could be painful. If you have a lesion like that and it's just not healing and you go into the doctor, it's probably worthwhile mentioning to your physician that, hey, I work around aquatic animals and this might be something to think about. Here's some other lesions, a little more serious, where you have sort of raised bullae on the hands that you'll see. Generally, it is located just into the extremities. However, someone who is immunocompromised, oftentimes you will see it move, and it'll oftentimes move from the hands to the lymph nodes. You'll tend to see that, and I've seen that occur twice, and these were all individuals that worked on fish farms down in Florida. But even then, once it's diagnosed, it can be managed relatively easily, but the course of antibiotics is quite long, 2 or 3 months. So prevention is really our key. Proper protective equipment, proper handling, common sense. So we want to have our preventive strategies for people handling the animals. Other than working at the touch tank, you're generally not going to be worrying too much about handling the animals. If you are working in the education area, helping with classes, that's certainly something you want to think about as well. Most of our animals that you handle there probably aren't going to be a big issue. They're pretty small. The little purple short crabs aren't really big pictures. But when you're talking about allergies, it occurred to me that may be an area we need to think about that a little more, especially with kids coming in that might have selfish allergies, because they may be handling those crabs during the classes. So we develop preventive strategies for our animal health management, because if we keep our animals healthy, then that reduces your risks as well. So we're pretty aggressive about that. But what do you want to think about? Keeping open wounds covered, wearing gloves over that if you need to work with in the water. Hand washing, soap and water regularly, just like Matt talked about. Wearing those latex powder-free gloves. Some people are allergic to latex, and we can certainly provide nitrile gloves or something like that if that's something that you need. Just let us know. Don't eat or drink in the animal areas. That's signed up pretty well right now. Don't store food or morts near the biological samples. So where we keep our morts, we don't want you to put your lunches in that. Okay, it's just a good thing. And then regularly visiting your physician, but also mentioning to your physician, where you volunteer or where you're working, and so that he or she can be thinking about some of the risks that might be associated with that. Certainly something that you want to relay. If you're immunosuppressed or immunocompromised, you want to try to minimize your exposure with animals or tank water during that period. If you're ill, try to avoid animal or tank water contact. It's certainly something that you should consider. And again, Matt talked about this already. If you have an injury or a wound, let's get proper first aid as soon as possible. And we have first aid kits here, and we can manage those things pretty quickly. And then we're doing this. We're trying to keep you, aware of possible zoonotic disease risks, and so that you know what's going on. And if we identify any of these, we'll let you know. So, for instance, I can let you know right now, We have our zebrafish tank right out here. That tank is positive for mycobacteriosis. So we will, at this point, we're going to be managing. We only have one person to send, 2 people to take care of that tank. Volunteers won't be doing that, and we're going to decide actually how we will manage that system in the future. Typically, we can manage those animals, that population, without depopulating it. But we just got these reports in, so we'll be deciding how we're going to manage that. But that's an example. We don't know what type of mycobacteriosis it is, what species it is, but we know that 2 fish that we submitted came up positive for that. Any questions? Yes?
What is a mort?
Oh, I'm sorry. Mortality, a dead animal. Sorry. So if you've got a wound, watch for signs of infection. Redness, painful wound, heat in the area. Does it feel hot? Do you have joint pain nearby? And you have a fever or it's not healing. Any of those things that you're seeing, you want to consult a physician about that. So the big risks basically come from our animals that are under stress. And frequently our animals are under stress. We try to minimize them. But then also animals that have active disease. So what we try to do, not only to protect our animals, but also to protect you, is when we see sick animals, they are moved to the hospital right away. Or as soon as we can catch them out of the system. Sometimes even though they're sick, they don't want to be caught. But those are 2 of the things that we try to do. So animals that are stressed or disease really are at greater risk. So the stressed animals become immunocompromised, just like us. We get under high levels of stress, we become immunocompromised. And so that's generally going to increase their bacterial loads and their risk, which is one of the reasons we try to remove those animals right away. Also because oftentimes those bacterial loads will be in the mucus layer of the skin. So again, when we're handling these animals, just like Matt talked about earlier, we're usually wearing gloves when we're moving those animals around. The other thing that you need to consider, we try to pay close attention to this here, but it is an issue. If you have home aquariums, this is an issue, something to keep in mind, is that inappropriate antibiotic use can lead to resistance of these bacterial agents, and meaning that they will not be these agents will not respond to the common antimicrobials or antibiotics that we would use. They become resistant to it. And why is that important for you? Well, not only can we not treat the animal effectively, but then those are drugs that, should you become infected, then are probably off the table to use for treating you as well. So this is something to keep in mind. Most of the zoos and aquariums now are really cognizant of this, and I would say that since I've been doing this, our antibiotic usage has decreased dramatically, and we focus much more on preventive health, just for this reason. But within the pet fish world, antibiotics are still used indiscriminately and overused. And so it's something to consider if you have a home aquarium and you have sick fish. Oftentimes, what you would buy over the counter will be ineffective. And so you want to think about that. Maybe if you have some fish that are really sick, you may not want to treat them. You may want to just cull them to protect yourself. So what can we do in terms of management? Well, we reduce crowding, we use quarantine, we have separate systems. These are all things we do to keep our animals healthy and to protect you and us. We'll try to have separate equipment for each system. So we have a lot of equipment, you'll notice in the food prep area out here. It just stays out here. It isn't used in the West Wing and it isn't used in the hospital. We use disinfectant baths and rinses pretty regularly. And we'll leave them in there for the appropriate period of time. So another thing to think about, make sure you ask if you're helping us how long I need to leave a tool in the disinfectant bath. Typically it's at least 20 minutes with the concentrations we use. But then we try to air dry them before we use them again. And then we want to keep our tanks, we try to keep our tanks clean of organic debris and uneaten food as much as possible, because those are great nutrient sources for a lot of these bacteria that can allow them to increase in numbers in the systems. So when we're talking about managing zoonotic disease risks, it's protecting you and giving you information, but it's also how we manage our animals that are really important as well. If you go back in the back area, you'll see foot baths, particularly going into our hospital quarantine area. We're changing those. We don't change ours daily. How frequently are we changing those, Sid, now?
2 weeks.
Every 2 weeks. Okay. Because they don't, compared to other places, they don't get a lot of use. So we're monitoring our animals' health pretty regularly. We have detailed records so we can trace things back. We have a sick animal, where did they come from? Where have they been? We can follow those things back. And then we're basing, whenever possible, we're basing our treatments on an appropriate diagnosis. So we're not doing what we call in the industry shotgun treatment. I don't really know what it is, but we're going to throw all these drugs at it and see what happens, which is pretty common. We really try to get a proper diagnosis whenever possible. So, in general, if you're using good protective equipment and you're healthy, you have a good natural immunity to most of these marine bacteria that you would encounter on the surfaces. I'm not talking about eating our display animals, but that you would encounter in your skin, with cuts and things like that. But really, our key to preventing these zoonoses is common sense, really good husbandry and hygiene on both our parts as well as how we maintain the animals, and then our really rigorous health management that we try to implement. And kind of the way I think about it is if we keep the animals healthy, it's going to reduce the risk to you and us and keep us healthy. Okay, any questions? For either of us. Yes?
Our octopus handling policy, it says that if a visitor or anybody is bitten by the octopus, we should call an ambulance immediately. That doesn't seem appropriate. What do you think about that?
Couldn't hear the question.
The question was if our octopus handling policy says that if a person is bitten by the octopus, that we should call an ambulance immediately.
We need to change that.
Yeah.
I think they should be directed to, signs of infection.
Yeah,
see if
obviously
there's
first aid.
Yeah, first aid.
Signs of,
And something that people can hand out if somebody needs to take it. Okay, good. Thank you.
Okay, yeah, I would say that we don't need to do that unless we see a reaction right away. I don't actually remember that being in the protocol. Okay. Any other questions? Any comments you want to add now? Yes?
I have a question about the touch tank in particular when people come in. I know at other centers, they have you wash your hands first and then touch the animals and then go wash your hands. And they don't have anything set up like that. And I know some people, especially now that it's colder, have a lot of lotions and stuff in their hands. And they don't think about it. And another thing is the artificial fingernails. Is that an issue at all for health for our animals or for themselves?
I hadn't thought about the artificial fingernails. That could potentially be an issue. One of the reasons that we don't ask people, and the lotions didn't occur to me, and that could be something that we should do. One of the reasons that we didn't ask people to wash their hands before they went to the touch tank is that a lot of the soaps and things, if they get into the tank, it's very toxic to the invertebrates. So.
Well, now you have the alcohol-based sanitizers that we
Right, but the alcohol-based sanitizers are okay as long as they're not, they don't have any scents in them or anything like that. And those sanitizers, and correct me if I'm wrong, that needs to be in contact on your skin, has to fully evaporate, which is about 30 seconds
At least.
to be fully effective. And people aren't typically going to do that, wait that long. So what we have decided, and I'm open to changing this if we decide it's necessary, is that we don't have them wash their hands beforehand, but we suggest that they do afterwards.
Well, our water is constantly circulating, and some of that water that you're talking about might be still water. Am I right or not?
I don't know, I was just asking if it was an issue, because I know that I've seen people put their hands in the water and then you can see the lotion just kind of dissipating, and I know that a lot of people will use hand sanitizer before they touch the animals and then afterwards too. So I'm just asking if these are issues.
In Arizona, we had the sunscreen, that was the problem.
Yeah, and that's probably an issue we need to talk about, but in terms of the hand washing beforehand, I guess we haven't recommended that because of animal health concerns. The fact that those touch tanks are constantly flushing certainly helps recirculate. That might even be a bigger issue. But certainly recommending that they use hand sanitizer or go wash their hands afterwards is a good recommendation.
And then as far as staff, as far as fake nails, I do put them on occasionally and do recommend touch tank. Is that something that's going to change as far as policy?
Well, that's something to think about, because I could see an animal thinking something like that, and we could get an impaction. So we've certainly seen impactions, not from that, usually it's from rocks. You know.
I didn't hear what you said.
Fake fingernails that might come off.
Oh, okay.
I think that's something we're going to have to talk about. I hadn't even thought of that.
Have you seen fingernails?
The only reason I bring that up is that I worked in the hospital for a long time. Staff was not allowed to use the infection process. So since I don't work anymore, I thought, oh, this is great. But then I started thinking about, especially with the stuff, you know, those are really good breeding grounds both ways. So I don't think
That's a good point. Any other comments, questions? Yes, sir.
I know, I noticed in Dr. Philpott's illustrations, some people doing their necropsy, they had the face mask, and but their necks were bare. And I was wondering, men particularly, when they shave, they do lesions and microscopic nicks and such. And I thought maybe that might be an area that should be closed up.
Certainly if you have an open cut there, yeah, I would definitely cover that in some way, yes. Generally, people doing necropsies will not take extra steps to cover their neck. They will have their face and their nose and mouth covered with a surgical type mask, and then eye protection generally.
Yeah, that illustrates. I just kind of think of the microscopic little nicks and things.
Yeah, certainly that is a possibility, and if there is a potential for a lot of splashing, if it's one of real messy necropsy, which sometimes they are, then a face shield would probably do the trick, because that goes down quite a ways, actually almost to the chest, and so that will help protect the neck.
Any other comments, questions? Okay, well, thank you for coming. And I think we've captured this.